Christy came home for the first time for her surgery. Her ankle was all swollen. It really looked bad. I just didn't really want to look at it. It was really disgusting.
So this is my 5th surgery on my left ankle for my vascular malformation. In other words, too many veins bring blood down and not enough veins bring blood up. Basically, they inject alcohol to close up the extra veins that I have. So.
Well, when I found out about it, I was a little kid, so I didn't really know about it. But as I grew up, I figured out that it was a really hard time for all of us, so I just did whatever I could to help.
I'm really glad I'm getting the surgery actually, because my ankle has been hurting a lot lately, and I don't like to take pills because I just don't. I'd rather feel pain than nothing at all. I've just been wrapping my ankle up in this. So this is my foot with the vascular malformation. Yep, right here.
It just holds you back from doing things like running and stuff like that I know you used to do in middle school. There's not really good part to having surgery or having a...
Vascular malformation is all right here, and the main part is right here. It's really sensitive, just right here.
I wouldn't really know how much pain or like things that would go into it, or how much you would have to sacrifice. I just try and do whatever I can. Yeah.
Now, in the past when they treated you, did you ever go to Children's?
No. But somebody from Children's came.
Oh, they did?
Yeah.
Okay.
I don't think the last time anybody came.
Did you go to anesthesia pre-op prior to this? You would know. You'd sit down with the anesthesiologist and they'd ask you about your procedure. So, the last time you were seen was with Dr. Pakpas? Is that right?
Mm-hmm.
So you haven't, he's been gone a long time.
Yes,
You guys
we
haven't
were
been here
waiting,
a long
we
time.
were waiting for him to come back because we were...
Well, you know, Dr. Airford's really good.
Yes, I did.
So,
Here I am in UCSD Medical Center. I just had my MRI, where they gave me my handy dandy IV, and they bandaged it up.
any problems with latex?
Nope.
Any high blood pressure, heart disease? Any asthma, chronic lung problems?
Nope.
Smoking history?
Nope. Those of you who don't know what an MRI is, you basically go in this gigantic donut-shaped thing, and it's a gigantic magnet that spins around you really fast to take pictures. Yes, a magnet can take pictures. Yeah, it usually sees like your blood vessels and your veins and your arteries and all that good stuff.
With Dr. Eric when he gets here. I'm just going to ask you a few questions. So the plan is for you to go home today?
Yeah.
We'll just get it done with. Yeah.
Right now? So anyways, I just gave a urine sample for a pregnancy test. Woo!
Are you having any pain today?
Nope, it's just right here.
Any changes in your health or this little area since I saw you?
It's been hurting a little more
More?
every day, yeah.
Okay. Before we actually get you nice and sleep. Can you tell me where those areas that are hurting more?
The other day I got a really sharp pain right here.
Okay. So part of that may or may not be related, obviously, to what's going on underneath. You know, the venous malformations can cause pain, but you might just have musculoskeletal pain too. So depending on what the MRI shows is going on between here and here, I'll focus on the areas you kind of pointed out. We'll try to address if there's something underneath here to treat, and then I'll see down here. Sound good?
Okay.
Okay, so if these are the only two areas that are primarily hurting you, I'm going to still look.
This area, but she put this one because it's the top of it.
Top. Okay, that's good to know. Okay.
Communication. It's important.
Very important.
And then I just want to go over the discharge instructions.
All right, we'll take a look. What's the approach?
Circle is numb, like in this area here.
Like if you push hard enough or whatever,
So you
I
feel
can
that,
feel
but you don't feel light touch? Okay.
it. Or temperature.
Okay, so wiggle your toes. Okay. You feel this here?
Yeah.
Feels normal? Okay, and then push against my finger with your toe. Good. Good. And does this feel normal here? Okay, and I'm just going to lift you up a little bit. Out here, does that feel normal? Okay. I want to put it back in the IV now, which is working. You can see I'm drawing a little bit of blood into the syringe. And now I'm going to give that blood back.
With what?
And we're going to just wait for a moment, and then we're going to connect a new fresh connector up. Michael is bringing that for us. Stand like that. Cap on here. Thank you. Okay. I just want to wipe it so that because I won't need a little blood picture. You helped fix your own IV. So Mike, you had a very good effect on her. She's decided she's going to go to medical school and maybe go into anesthesiology. So
It is true, though. Drugs. It is true.
Career-changing drugs.
good.
Okay, have a little sleep.
A lot of the signal abnormality I'm seeing on MRI is probably areas that have been treated and or because of treatment have not collapsed. There's really not much there for me to focus on. I think you'll get pretty good results from this. I wrapped your foot. I want you to keep it wrapped. And for the next almost a week, as much as you can, except when you go in the shower. And then after that, for another week, just kind of when you can tolerate it, keep it wrapped. It keeps that area decompressed and keeps all the blood out. And so hopefully those veins will stick together and then they'll keep it flat. I think you've done well with it now, shy of the numbness that you have in your foot. So I think it'll be good.
Great.
Yeah, she's here. Do you want to come up and see her? Okay, hold on. Let me get the nurse. Lex, do you have a room for Miss Chickaway? Yeah. How soon she's gonna be gone?
He's just a little guy. It was fun. I don't feel any pain right now. This is my 5th one. Don't even matter. My ankle kind of feels like, not pain, but like discomfort. So right when I got to the recovery room, I like woke up and just like was aware of everything, and like the nurses were talking about like this is her fourth one or something. I'm like fifth. All sleepily. Like also the pillows are like donuts. I don't know what is up with this hospital and donuts. Donut shaped things, but like those are some pretty awesome pillows if you're just staying in one position. They had stickers all over me. Usually they always miss a sticker for some reason. It's like to measure what I was talking about in the car. They have little stickers on you. Actually, they did miss one. It's on my hip. So they have these stickers, and they will connect a wire to the center of this to monitor everything about me. Basically, as soon as I got home, my ankle started hurting super bad. It's probably been the most painful experience of my life. It's very swollen. The pain is usually right here, which is very odd because the surgery was here. It's really hard to sleep. I'll go to sleep and then half an hour I'll wake up because of the pain, and then I'll have to stand up, which is horrible. It's like getting up 20 times in the middle of the night. Oh, my brother has been really good about helping me out. It's actually quite nice. It's been a couple weeks now, and learning how to walk again was super difficult, and I actually had to use my crutches to help me. And speaking of crutches, I was in them for about a week. At my school we have 4 flights of stairs. It's 3 stories, so I have to walk up them every single day. Luckily there's an elevator that I usually use, but I've been walking up the stairs lately, and I think I'm getting pretty good at it. At first I had to like limp across to the elevator and type in the code, and now I'm walking upstairs. Another successful round. Like, my ankle still hurts at times, but over a long while, it'll get better. I hope you enjoyed this video.